Hi guys, welcome back to my channel. This is Dr. Paula. Today I decided to record this video on the outside. I wanted to share some nature, some flowers sitting in my back patio. I live not far from a small airport, so if you hear small planes flying overhead, please excuse me. You may also hear neighbors mowing the lawn. Okay, today I'm going to be talking about 7 things you need to know about getting a mammogram. You know that if you qualify for a mammogram, that means if you're of the age group to have a mammogram, you need to have it done every year. Now, mammogram is not the most comfortable thing. I know many people don't like it. I don't like it. As a breast cancer survivor, I have to have it every year. And so it is not the nicest time every year to go into the hospital and get your breast squished by a machine. Okay, first of all, you need to know when your mammogram is due. So if you have been getting mammograms, you need to write it down in a calendar, in your little calendar, in your personal note, and be sure that you are not skipping every year. I remember when I qualified, when I was due for a mammogram, due to work constraints, I delayed it for about 4 or 5 months, which I regret doing actually. You want to have your mammogram timely. Don't be a procrastinator, because if you have something abnormal with your breast, it's not sitting around, okay? It's moving, it's spreading. It's what we call metastasizing. It's moving from the primary location, which is your breast, and it's moving to other organs in your body, like your liver, like your lung, your bones, your brain, okay? So first thing you need to know is, what is a mammogram? You know, it's an x-ray of your breast that detects whether there is any abnormality in your breast, whether there is any lump, whether there is any abnormal features in your breast. Okay, that is a mammogram. It does produce a little bit of radiation, like any other x-ray. It does produce a little bit of radiation, so that is really nothing to be concerned about. What you want to think about is the risk of not having the mammogram versus the risk of being exposed to a little bit of radiation. And the risk of not having a mammogram is greater. You can get breast cancer, and you're going to go through hell trying to get treated for breast cancer versus a little bit of radiation. Okay, other thing is, find a center, a clinic, or a facility that does mostly mammograms. It specializes in mammograms. I'm using my little cheat sheet, which comes from the American Cancer Society. You want to find a facility that specializes in mammogram. They are doing hundreds and hundreds of mammograms. They know exactly what to do. They're not going to give you the results of your mammogram, but they will know exactly how to give you quality pictures. Okay? And the benefit of using the same facility in that they can compare your images from year to year. So they can look at last year's image. The radiologist at that facility who's interpreting your mammogram results can look at last year's image and tell whether something has changed. So that's the benefit of doing using the same facility for doing your mammogram year after year after year, unless you have no choice. Okay. Number 3, you want to schedule your mammogram at least 1 week after your menstrual period. You know, during your menstrual period, especially if you have fibrocystic disease of the breast, your breast is more tender with all the hormones that are being produced. Your breast is more tender. And so when pressure is applied to the breast, you don't want it to be uncomfortable. So don't do it right after your period or when your period is due. You want to do it at least 1 week after your period. Okay? Number 4, when you go for your mammogram, you want to dress comfortably. Of course, you know your top, they will ask you to remove your top and your bra. And you probably want to wear something like a capri pants or warm-up pants, sweatpants, and a t-shirt or comfortable top, because you will need to remove your top and your bra to have your x-ray done. Okay, number 5, you know the procedure is going to take about 20 minutes. They will compress your breast between 2 plastic plates, and they will be taking images sideways and frontways and whatever position is necessary. Okay, once your mammogram is done, you will probably get your results within a week or two. Okay, if you don't get your results, if you don't get the results of your mammogram, you need to consult the clinic, or if you request that the results was sent to your primary care physician or OB-GYN or whoever ordered that mammogram, you want to call the clinic to find out what your results were. You know, we are living in very, very busy times, and sometimes things can be overlooked. Sometimes they're not really overlooking your results, but they're working with so many different patients that your results, calling you to give you your results, might be delayed. And you know, these days with all these my chart where your results are sent to your account with your PCP, you have to log in. Sometimes you don't get a call. You have to go onto your my chart, which is your medical record online, and check your results. So don't hesitate, don't delay. Check the results of your mammogram, and if anything is abnormal, please be sure that you are scheduling an appointment to see a medical oncologist or a doctor that specializes in breast cancer. Okay, and then if anything is noted, let's say they suspect you have a lump or some abnormal, your doctor will refer you, and they will discuss how you will go forward with that, what plans, or they may actually send you for another test to confirm that it is truly abnormal. So you may have an ultrasound, or you may be sent for an MRI. And as we have said in the past, MRIs can be very, very sensitive. And when we say sensitive, we mean that it will pick up any abnormality that is present in the breast. And so sometimes abnormality can be magnified. So sometimes it may not be a cancer, but any little abnormal stuff that is present in the breast, the MRI is likely to show it. So your doctor will decide what to do if something is detected on your mammogram and ultrasound and your MRI. So anyway, once you've had your mammogram and your results are given, whether it's normal or whether it's abnormal, there is actually really no need to be anxious about it. In the past, we thought that breast cancer was a death sentence. Cancer, as a matter of fact. Once you were diagnosed, the first thing you thought was, I'm going to die. But these days, there are so many protocols, so many regimens, to treat cancer with. There are so many advanced, treatment for cancer, and new drugs and new surgical procedures and so many things. In the past, if you had breast cancer, the first thing they jumped on was a mastectomy. They took off your whole breast. Now they can do a lumpectomy when they can just target just the area with the abnormal tissue. So there is absolutely no need to be anxious and work yourself up. As a matter of fact, if your mammogram results came back positive, you really, really need to have that positive attitude, because that's what's going to carry you through treatment. Okay, so be positive, don't be anxious, and just really let everything in God's hands. I mean, He has the final say. He promised you that He'll fulfill the number of your days. So regardless of what you're diagnosed with, you need to be calm and you need to be patient. So this is it. That's what you need to know about your mammogram. Please do not procrastinate. Do not put off your mammogram. You need to have it done every year, because once something is abnormal, it does not sit one place. It moves, it spreads to the rest of your body. So please take care of yourself. Be good. This is Dr. Paula. If you have not subscribed to my channel, hit that red subscribe and hit that bell, so the next time I publish a video, you'll get a notification. Thank you so much. Thank you for watching, and have a good day. Bye.